Okay, this is the final chapter under examination and treatment quality, careful, thorough physical examination. One of the things I would recommend is to really thoroughly review the physical examination photo guides that are posted on Aquila. This will show you the proper technique that you should follow when conducting a physical examination. It doesn't really tell you what you should be doing when you're confronting a certain kind of complaint, but it does tell you the proper maneuvers to follow when conducting a physical examination. So that's where I would start, is understand the criteria under the photo guides. But one of the things that we want you to pay attention to is that if you're going to conduct a physical examination, that whatever you do, we would like you to do it thoroughly and carefully. And let me just give you a few ideas here. So for example, if you are going to auscultate the anterior and posterior chests, this illustrates the locations where you would actually place your stethoscope on the front and back of the patient. Another thing to pay attention to is proper draping of the patient, whether you're working on the patient's back, for example, when you were doing OMT, or if you're performing a physical examination, or if you're examining the patient's abdomen or groin area, you want to make sure that you always drape the patient properly. As I mentioned earlier, there's a lot of overlap in all of these skills. When, for example, you properly drape the patient and protect their modesty, the patients will view this as a form of empathy and caring, and your scores can go up. It's not just about scores, though. It really is about properly caring for the patient and communicating proper care and competency that the patient really requires. When starting a physical examination, the thing that you really want to do is to first look at or inspect the patient. Whether you're dealing with a standardized patient or an actual patient, don't be hesitant to lower the gown or remove it as appropriate so that you can get a complete look at the patient. One of the things I've always appreciated about osteopathic medicine is that it's very visual. It starts by a careful look at or an inspection of the patient. So that's going to be an expectation. You want to always auscultate on skin and never over the gown. You want to always percuss on skin and never over the gown as appropriate. You want to palpate on skin and never over the gown. You want to also be aware of the patient's pain and discomfort. Again, it's an empathy issue. One thing that you could do if you're palpating a patient's sore abdomen, you would also want to look at their expressions to see if they're wincing or feeling pain. Some patients are stoic and don't express pain even if you ask them if it hurts, so you have to look for signs. And remember, I said that listening was really looking with your eyes and ears. It's not just listening to the patient, but it's also looking too. You want to treat the patient with care and avoid, for example, moving them up and down a lot. This comes down to having an organized physical examination. To score in the lower end, we would be looking at what might be considered a superficial examination. For example, not palpating deeply enough to ever feel anything, and you may score on the physical examination checklist well because you did it a bare minimum to gain credit, but you may lose points on the careful thorough physical exam part if you don't really for example, palpate with care to really actually feel something. Likewise, if the exam is rough, that's not going to work. I already mentioned the need to examine the patient on skin versus over the gown. If you rush through the examination, or if it appears to be disorganized, you may not score so well. So whatever you do, do it with care, because it'll simply help you to gather better information and also gain points if the points really matter to you. And we do this. We give you the formative assessment of your communication skills in order to improve them. So what I would really recommend, though, is that you go back and review the PARS guide in its entirety. It'll give you better ideas of what the standardized patient is looking for. And also, it's a good guide to patient care and how to properly treat the patient and how to communicate with them. So I thank you and look for some of the accompanying videos that will soon accompany this guide. Thanks.